I call the honourable member for Bowman.
Thanks, Madam Speaker. A question for the Minister of Health. Would the Minister update the House on the steps that the government is taking to ensure that we're prepared for a confirmed Ebola diagnosis in Australia?
I call the honourable Minister for Health.
Thank you very much, Madam Speaker, and I thank the honourable member for Bowman for his question. I want to pay tribute to the Chief Medical Officer, to the Chief of Defence and to the Head of Border Protection, those people who have been advising the Prime Minister and myself, other members of the Executive and also the health officers who are running public hospitals around the country. There has been a national collaboration to make sure that our country is at the highest level of preparedness, and I'm very pleased to say that we have been able to build on the level of expertise of the doctors and nurses that we have around the country in tertiary hospitals that can quickly isolate and quarantine a patient if there is a presentation confirmed of Ebola. We also have a world-class response at our airports where if people having come from West Africa arrive into one of our ports, we are able to identify those people, provide the appropriate information to them, investigations in relation to their activities in West Africa, particularly whether or not they had contact with somebody who had contracted the virus or whether or not they had been to a funeral within one of the three affected countries in particular, and we can, with the support of the state health officers, quarantine those people if appropriate or conduct testing as may be required. The other great capacity we have, Madam Speaker, in this country is to be able to very quickly trace people with whom an affected patient may have had contact, to conduct tests rapidly on those people and to make sure that we have the appropriate medical response. We also have the assets and the capacity to provide a very quick and rapid response to provide support perhaps to an island nation within our region. We wouldn't expect, of course, healthcare workers to come from the other side of the world, from France or Belgium, to try and provide support to affected patients in our region. We would be expected to provide that support and provide the support we will. We have the capacity to provide that out of Darwin, and that is something that we are able to do, Madam Speaker, and we would step up to the plate. We are also, of course, providing support through the United Nations and other NGOs on the ground in West Africa, and we are working with partners to see what further assistance we might be able to provide. And I welcome the contribution of the member for Sydney, who in a press conference just a week ago said, and I quote, "We have to do everything that we can to make it as safe as possible for our medical staff." The problem was that the member for Sydney then realised that she was live to air and quickly turned to camera and said, "Could we start again?" Because up until that point, the member for Sydney had been critical of the government's response, and it is quite sad that there is not a bipartisan approach, and I want to say thank you to the Leader of the Opposition who's been able to tame the member for Sydney over the last few days. We will provide an appropriate response. That's the government's charge.
Time has expired.